All right, in this second video, we are going to be doing the lateral part of the thigh. So just again to kind of give you a view of where we are located here on the cat. So again, you can see we still have it on the ventral or dorsal side, ventral side up. Here you can see the medial thigh muscles that we've done. So now I'm going to go over to the lateral side here to do our lateral thigh muscles. You can see this is the leg here. Just going to put on my other glove quick. So now here on the lateral side, we're going to get another view of our hamstring muscles, and we're also going to be able to see the gluteus muscles as well as the third hamstring muscle, which is the biggest one, the lateral one, called the bicep femoris. So when you look at the lateral side of the leg here, this big muscle, the ham hock side here, that is actually the lateral hamstring muscle called the bicep femoris. Now there are two other hamstring muscles. The two medial hamstring muscles are the semitendinosus, which is the more superficial one when you're looking at the medial hamstrings. And then you have the semimembranosus underneath that. Now, right now all you can see is this very big bicep femoris. So we're going to cut underneath that. You can actually already kind of see the outline of my bicep femoris right there. So I'm going to kind of follow that line, and then you should be able to kind of stick your finger in there. And then again, you just want to follow, cutting the connective tissue line that separates those muscles. And again, since it does connect to the knee here, I don't know if you can see that, it does connect to the knee. The knee is very white, has very thick connective tissue, so it is going to be a little bit harder to cut at the knee. Try and pull that down, give you a better view here. Once you get in there, you should be able to see that connective tissue string to separate it. And then you're going to just continue around the knee here. And it does actually go all the way down here, somewhat down into the lower leg. So it is a pretty big muscle. One of the things that I have noticed as I work with my scalpel is that if you want to use your scalpel or it's getting hard to tear away the connective tissue with your probe or your finger, if you use your scalpel backwards like this, sometimes that will help you get through the connective tissue without actually cutting the muscle. So I'm just kind of working away at the connective tissue on the inside here to pull my bicep femoris, large hamstring, all the way down to the thigh there, kind of exposing some more of these muscles in here. Now, one of the things that you'll be able to see when you pull that bicep femoris is this real thick, whitish looking string. And if you follow that string, it should go all the way up into the buttocks area and come all the way down through the lower leg. I will tell you this is a nerve, that long, thick white string. And you think of a nerve that goes from your butt all the way down your leg. That is actually your sciatic nerve. And you can see how large it is in the cat. Imagine how large that is in your leg. Maybe you can understand why it causes so much pain with those that have sciatic pain. Sometimes there is a muscle that likes to stick to the bicep femoris. And that muscle that sometimes like to stick to the bicep femoris. Now mine did not. It is right here. Just going to kind of pull that up. So this little muscle here, again, sometimes it likes to stick to the bicep femoris. That is called the caudo femoralis. This is not one that we have in humans. Caudo means tail, so you can see it kind of goes up to where the tail connects. Femoralis for femur, so from tail to femur. You're going to have to lift that caudo femoralis up to be able to see the gluteus muscles. So now what you're looking at right here, underneath that caudo femoralis, is the gluteus maximus muscle. I'm going to try and clean off some more connective tissue so you can see that butt muscle. Now I'm going to lift and kind of cut underneath to lift that butt muscle up. And now with that butt muscle lifted, you can see the gluteus medius underneath it. One of the things that you'll notice is that the medius is actually thicker than the maximus. That's because cats use their medius more often than their maximus, so it is going to be a little beefier or meatier than the maximus. The maximus is called that because it takes up more surface area, more space. And then underneath that, you have the gluteus medius. So I'm going to rotate the screen here and kind of go through those muscles with you from what I can see. Okay, so you have the very large bicep femoris here. Pull that back, and now you get a different view. You'll also see this patch of fat here. All cats will have that. You can remove it and put it in your red biohazard bag. Now you should be able to see the lateral side of those two hamstring muscles that you saw from the medial thigh. The more superficial one here is the semitendinosus, and then you have your semimembranosus here. It is the same muscle. If you stick your finger on it and flip it over, you'll see it is pressing that same semimembranosus and semitendinosus from the medial side. You can just view it from both angles. Here's that big, thick sciatic nerve there. You have your caudo femoralis here. You have the outer, more surface area, gluteus maximus. And then underneath that is the meatier gluteus medius. And just because it is on the lateral terms on the paper, again, this is your tensor fascia latae with that nice thick fascia connective IT band right there. Shorter muscle.